Hi guys, so here we are at chapter 5 and we're going to talk about mood disorders. And the mood disorders are going to include 2 different depressive disorders and then 3 different disorders related to mania. And so we're going to go through them one by one to make sure you understand them and then do a discussion of etiology and treatment. And so we'll have a number of videos here. So first, let's start with the disorder that I think most people are most familiar with in this category, which is major depression. And when we're talking about major depression, you can see the DSM criteria in your textbook or in the DSM database, but we're talking about somebody meeting criteria by hitting at least 5 of the symptoms listed in the DSM. And I think one of the most important things to notice right off the bat is that the first symptom is sad mood or loss of pleasure. Now you can have both, but you don't need both to get that check mark for that criteria, and which is really interesting given that most people, I think, believe that everyone who is depressed is sad. But lots of people who get diagnosed with major depression actually don't describe their mood as sad. They may describe their mood as flat. They may describe themselves as having a hollow feeling. They may mostly present as irritable. So not everyone presents as sad. And so you don't need to have that sad mood, but if you do, that's fine. And if you don't, you instead need that loss of pleasure. And loss of pleasure is loss of pleasure for everyday activities. So the way I usually ask this when I'm meeting with somebody for the first time and trying to assess depression is I ask them what hobbies they normally engage in and what activities they normally enjoy, and then they give me that answer, and then I ask them whether they're still enjoying those as much as they typically do, or when was the last time that they enjoyed that. Another thing that I'll sometimes ask about that loss of pleasure is to ask them when's the last time they can remember really laughing. Because most people are not experiencing pleasure will say, I don't remember the last time I laughed, or they'll say, I don't laugh much anymore, or something similar. And then we have sleep disruption, and that, as you can see in this list, might be too much sleep, it might be too little sleep. Too little sleep might be difficulty falling asleep, it might be middle of the night awakening, it might be early morning awakening, waking up at 5 when you don't need to, and being unable to go back to sleep. And so it's just about the dysregulation of sleep, the disruption of sleep. Psychomotor retardation or agitation has to do with how likely you are to be moving your body. And I realize that should be 2 bullets there. But psychomotor retardation or agitation is either retardation is like it really takes a lot for you to move and you move slowly, or agitation might be your leg going like crazy all of the time. There's other reasons that might happen, but if it's happening during a depressive episode, it counts as a symptom. And then this thing that should be its own bullet is about weight loss or change in appetite. Other people sometimes do gain weight as a result of change in appetite, so it doesn't have to just be diminished appetite. Loss of energy to do things, feeling worthless or having excessive guilt. And then that difficulty concentrating, thinking, or making decisions. I often will ask people if they're students what it's like to study or read a textbook. If they're not students, I might ask about whether they read for pleasure and what that's been like lately, or whether they can follow along the plot for a complicated movie or television show. And usually you can get it that way. And then you can have recurrent thoughts of death or suicide. And again, this is one of those where lots of people assume that everyone who's depressed feels suicidal, and in fact that is not nearly the case. And you could easily see that you can meet 5 of these criteria without having thoughts of suicide or death. And lots of people who are depressed do not feel suicidal. And in fact, lots of people feel suicidal who are not depressed, and we'll talk about that more. So in terms of timeline, in terms of significance, and this goes to the question of, our 6th step, right? The line between disorder and no disorder, the 6th step of that differential diagnosis steps. You need to have the 5 symptoms nearly every day, most of the day for at least 2 weeks, right? So what that means is that I'll ask people, if they ask them if they're sad and they say yes, I might say, are you sad for part of every day? And they'll say, no, I'll say, are you sad more days than not? And they'll say yes. And I'll say, on the days that you're sad, do you feel like you're sad most of the day or only pieces of the day? And they'll say, well, most of the day. And then I'll try to fine tune, like, how many days of the last 2 weeks have they been sad, to get a real picture of that. We could also have major depression even if you know why the person's sad. So that's an important thing that some people don't understand, is that if you have suffered a loss and you meet the criteria for major depression, you still can be diagnosed with major depression. And here we get a significant subjectivity that is going to reduce that reliability and validity in the way that subjective symptoms do. Because as a clinician, I get to decide whether your response is an expected response to the loss or if it exceeds the loss. So it could exceed the loss in terms of, I could decide, right? It exceeds the loss in terms of how significant your depressive symptoms are, and I don't expect somebody who's lost their uncle, for example, to have that kind of mood disruption. Or it could be about the length of time, that it's been 2 years since the loss, and I expect that that's not true for most people, and therefore this is major depression. We do note that it's about a loss when we're doing the diagnosis, but my point here is that grief does not necessarily rule out depression. That sometimes people develop depression because of grief, and we can get the diagnosis still. It's also really important when we talk about major depression, what we talk about, right, major depressive disorder, that's what MDD stands for, but what we talk really about is major depressive episodes and whether somebody is in the midst or experiencing a major depressive episode. And so this is not very unusual. It happens, but it's very unusual for somebody with depression to be continuously depressed for a very long time, even if there's somebody who experiences chronic depression. So I can think of a client of mine very easily when I talk about this, because she has she first experienced depression many years ago, probably at least 2 decades ago, and she's in her 40s now, I believe. But that there are times when I've seen her, and I've seen her for quite a while, not 20 years, but for quite a while. There's times when I see her when she goes through periods when she's quite depressed. She's in the midst of a major depressive episode. And then there's other times when I see her, other stretches of time, when she does not meet criteria for a major depressive episode. So we can know somebody struggles with depression, even if they're not struggling with depression right now. And so they can be somebody who has a history of depression, you'll hear terms like that, but does not meet criteria for a major depressive episode currently. But it is important to note that 2/3 of people who have a single episode of depression will experience at least one more episode in their life. It might not be for decades, but it does increase the likelihood that you'll become depressed again. And the average number, once somebody has an episode of depression, the average number of lifetime episodes is 4 episodes. And of course, that's going to change depending on whether you seek treatment or not, whether you decide to. So I have patients who decide that they're going to stay in psychotherapy, they're going to stay on their antidepressants because they've already had 2 episodes of depression, and they just are proactively going to try to avoid a third one. And so the likelihood of repeated episodes comes down if somebody is actively engaged in treatment. And then the second depressive disorder that people are less likely to have heard about or to be familiar with is something called persistent depressive disorder, or PDD. And up until the DSM-5, this was referred to as dysthymia, which is a Latin term. And we've decided to get rid of the Latin term for a more descriptive English term, which I think is much better. We'll see when we talk about the bipolar disorders that for whatever the reason we have held on to its bipolar equivalent and kept the Latin term there. I don't know why. People with persistent depressive disorder have depressed mood, like that is the hallmark kind of symptom, that is the central symptom. But this is much less severe but much more ongoing than major depression. That persistent depressive disorder is not really it's not. Okay, sorry, I got interrupted. So PDD is a less severe but more prolonged form of depression. And so the criteria here is of depressed mood most of the day, and we are going to focus here mostly on the mood. For more than half the time, so for more than half the days essentially, for at least 2 years. So 2 weeks versus 2 years, it's a big distinction, right, between depression and persistent depressive disorder. And most people who have PDD actually have symptoms for far longer than 2 years. Almost everyone I've ever diagnosed with persistent depressive disorder has actually, when I question them closely, will say, I've never felt any different than this. Many of them actually are quite relieved to have a diagnosis and for me to talk about treatment options because they've just assumed that this is what life was always going to feel like. It was always going to feel flat and they were always going to feel sad and unexcited about things. And often they don't come into therapy necessarily because they think that this needs to be treated. It may be that somebody in their life thinks that that it would be good, so the partner's not enjoying living with them because of the PDD. But often it's kind of like somebody who's never had glasses and never had their eyes examined. They don't realize what it is that life's supposed to feel like. And so I've had the experience more than a few times of doing therapy and especially of starting somebody with PDD on antidepressants or like referring them to start an antidepressants where they can't believe that they could feel non-depressed essentially. And so, and in terms of longevity, you see here at the bottom, we don't see the absence of symptoms for more than 2 months at a time during the 2 year period. And so we have at least 2 instead of 5 symptoms that we need. And this poor appetite, sleeping too little, too much, right? 2 of these in addition to the depressed mood or sad mood that we would see. And so we're going to pause there before we talk about prevalence rates, and that'll be in a separate video.